Hey there, my name is Jillian Anderson. I'm a therapist here at Quest Counseling, and I'm going to talk to you today about cannabis use in pregnancy. The approach that this segment is going to take is talking about harm reduction and stigma reduction. It can be a really important thing to consider when we're talking about a relationship that somebody has with substances and with their own body. We're going to start off by talking about what is harm reduction. And I have a little video that I'm going to show you guys and a couple that will hopefully make it a little more interesting and a little more engaging, because this can be a topic that can be hard to talk about. A lot of times when we think about like looking at what our relationship is with substances like cannabis, there's guilt or shame or confusion as to like, okay, well, so I use this substance for a reason. Maybe it helps with my anxiety or my sleep or nausea or whatever it is. And if you're a person of the age who can get pregnant and you can get pregnant, maybe you're thinking about getting pregnant, but you're not sure how using cannabis might affect that. That's a legitimate question and something worth exploring. And we don't want guilt and shame to stop you from exploring that topic. And that's what can really happen around substance use and pregnancy when we get talking about those topics, is that people feel like, oh, well, if I use and I'm pregnant, I'm a bad person. And it just kind of gets to be either or. And really, what we want is we want people to be able to talk about their experiences and explore them so that they can find out and they can decide what's best and healthiest for them, their body, and their pregnancy. And so that's kind of why it's important to talk about harm reduction and stigma reduction, because if we can talk about something, and not just with friends, family, but with a professional person who's got education on that topic and who can be neutral, then we'll be able to have better information about it. And hopefully, we'll be able to make healthy decisions for ourselves, our bodies, and the pregnancy. So bear with me here. I'm going to pause and get this video set up for you guys. So I chose this video because when you think about, if you're a person who uses cannabis and you think about your relationship with cannabis, it's important to think about like, okay, like when I think about my relationship with cannabis and I think about talking about it, how do I feel? And so this is just, I think, an awesome way of talking, of like thinking about it. So if when you think about your relationship with cannabis and you think about like reducing use or quitting use, if you feel like this, cannabis, what should I do about it? I'm not sure. I think I'll think about it. Maybe I'll quit. Maybe I'll reduce my use. I don't know. Oh no, that's scary. So if that's your experience, then that's an important thing to be aware of. And then, this information might or might not be for you, and that's fine too. But it's an important thing to think about because it gives us information, and the more information that we have about our own experiences, the better. Now, if you think about your relationship with cannabis and your experiences more like this video. Okay, I'm setting up the video. It took me a little bit longer than I thought. So if it's more like this for you, where you're like, what should I do about my relationship with cannabis? I'm not sure. You're the cat and you're thinking about like, should I do anything about it? Maybe I'm thinking about getting pregnant, but I don't know. I'm not sure. I talk to my friends. And so if, yeah. So if it's like that nagging thing where you're like, maybe it's something that I want to think about, maybe I want to make some changes about it, then this is perfect for you because we want you to have information. And so that's what we're going to talk about a little bit next. So, as I was saying, if you're kind of like, I have this like nagging thought that like maybe my relationship with cannabis is unhealthy, like maybe I rely too heavily on it, or maybe like when I first started using it, it really helped with my anxiety, but now I think it might contribute to my anxiety. Or when I first started smoking, it really helped with my stress, but now I get really stressed out when I don't have it. Then like that's important stuff to think about and talk about. And so who can benefit from this information is anybody who can get pregnant. And so anybody with a uterus who's between the ages of whenever their menstruation starts to whenever it stops. this is useful information for them. Or if you know somebody who is in that situation, you care about them, maybe you're thinking about having a pregnancy with them, this might be good information for you to think about, and then also go ahead and share with them. So we already talked about kind of some reasons why people use cannabis and why they might be using cannabis while they're pregnant or while they're breastfeeding. And there are many people who do that. And this topic is talking about reasons why and then alternatives too. So a lot of times people will kind of get stuck in a habit of like, oh, well, this is how I've always done it, and so this is what I need to keep doing moving forward. And we want your thinking to be a little bit more flexible than that, hopefully, so that you think like, okay, so I'm a person who uses cannabis to help with my anxiety, and I plan on getting pregnant, or I find myself pregnant, and now I'm wondering like, what do I do about my cannabis use? Should I keep smoking or keep eating edibles even though I'm pregnant? Like, could it affect the fetus? And so what's important to know is that because cannabis is a Schedule 1 drug, there haven't been many studies that have been done on it. And so really the answer is we don't know. We do know that THC and CBD and other chemicals that are part of the makeup of cannabis do cross through the placenta. So they do cross through from the pregnant person into the fetus. And we know that. And so we don't really know the long-term effects of that. And that's the thing that is important to be curious about. And so if part of the reason why you're using cannabis is to calm your anxiety, there might be other medically approved substances out there that can help calm your anxiety. If you're using it to address nausea because you're already pregnant or you're experiencing it for whatever reason, headaches, whatever, it might be worth talking to your doctor about it to see if there's alternatives, medications that might have gone through clinical trials that have been proven to be safe for pregnant people to use and also people who are breastfeeding. And so really when we talk about stigma reduction and harm reduction, the idea is that it opens a conversation. We want the conversation to be open, and hopefully the person who's like got that nagging thought to feel free to talk about it. You can talk about it with your friends and family. They have information that's valid and you already know them and trust them. And if it's something that you're truly curious about, I really encourage you to talk with a therapist, talk with a licensed alcohol and drug counselor, talk with a marriage and family therapist or a certified professional counselor. There's lots of good resources out there that can help provide information for you about like, okay, what are your reasons for using? How can we help you either reduce your use, working towards quitting, working towards abstinence if that's what you want, or just like reducing your use or finding other ways that you can put into your toolbox basically to deal with the reasons for why you're using in the first place. And so that's kind of the basis of it. Therapy is not meant to be scary. It's not meant to be judgmental. Like really one of the best things about therapy is that it's somebody to talk to who can come in and be neutral and provide just support for you while you explore your relationship with cannabis. We just don't know enough about it to say whether it's good or not good for a pregnant person or a person who's breastfeeding to be using. We know that it has some effect, that it transfers through the placenta and then it transfers into breast milk. We just don't know the long-term effects. And so if that's something that you're curious about, you want more information about, really encourage you to reach out and get some support. And we'll go ahead and end with just a few like funny memes because that can be really helpful as a person thinks about like even if they're at the start or wherever they are in this journey in their relationship with cannabis or other substances. So here they come. Okay, so here's the first that I really enjoy. It just says, you've got to learn to feel. The therapist is going to say, got to learn to feel your emotions instead of masking them with drugs or alcohol. And then, you know, depending on where you are in your process, you might be like, no. And then there's always this good old one for depression. Me, I have depression. Someone, you should get out more, go outside. Me, goes to the beach. Now it's a tropical depression. And then finally, this lovely one from Drake. So the first picture letting the uncontrolled side effects of depression, anxiety, and addiction ravage your mind until you cannot process mental pain anymore and lose most of your self-awareness as nature intended. And the one below, talking to a therapist. So just reminding you that you have options, and really, we want everybody to feel as much as they can like the second Drake picture. So take care of yourself, get good information. There's so much information out there, and so it can be hard to sort through it. It's another thing that a counselor or a therapist can support you with. So hopefully this was helpful to you. And yeah, as I said, take care and good luck.